Okay, do you guys want to start now? Or maybe we wait 2 minutes or 3?
You can go ahead and get started, Alvaro.
Okay, so is it already on?
Yes, you're ready to go.
Oh, okay. All right. Welcome, everyone, and good afternoon. My name is Álvaro Celestino. I'm the Vice President of the EERI San Diego chapter. And welcome to this second seminar of our trilogy named Applying Lessons Learned from COVID to Seismic Scenarios. Like you know, the first part of the series was titled Using Scenarios for Preparedness. We did that 2 weeks ago. And the second part today, which will be presented today, is called Common Challenges Preparing for Low Frequency Events. And in today's presentation, Kristen and Jorge will discuss the challenges that we all are very familiar with of preparing for events that have certain uncertainty of occurrence to them, like, for example, climate change or pandemics or earthquakes. And for those of you that are not familiar with EERI, we are the Earthquake Engineering Research Institute. We are a nonprofit organization with the objective of reducing earthquake risk. And one of the ways we do this is by doing events like this that help improve the understanding of impacts of earthquakes to society. I'm going to jump to the next one. So we are on webinar 2, and the third webinar will take place on November 13th. And that one is called Next Steps for Earthquake Preparedness in the San Diego area. And hopefully you can also join us for that one. And remember that the series is free of charge, and you can go sign up on our website, EERI.org or San Diego EERI.org. I'm going to proceed to introduce the speakers. We have Jorge Meneses. He's a principal geotechnical engineer with RMA in San Diego, and he's also the president of the EERI San Diego chapter. We also have Kristen Chang. She is a senior geotechnical engineer with Group Delta in San Diego, and she's also a member of the board of the EERI San Diego chapter. And with that, I'll pass it on to Jorge and Kristen. But first, let me show you the next slide here, and so that you can see how to do the questions. So if you want to write a question, you can go to the question window of in the panel, the GoToWebinar panel, and you can write your question there at any time you want. The presentation will last approximately 45 minutes, and then we'll have another 15 to 20 minutes for questions. Again, thank you for attending, and now Jorge and Kristen.
Okay, thank you, Alvaro. The topic of today's presentation is common challenges preparing for low frequency, high risk events such as pandemics and earthquakes. This is a continuation of the webinar number 1 that we had 2 weeks ago. So this is the outline. First, we are going to do a brief summary recap of webinar 1. And then Kristen is going to describe some common hurdles that we identify for preparedness, comparing, preparedness for epidemics and pandemics and earthquakes, public perception of risk, communication, spread of misinformation, and investment. And then I will discuss about the issues related with social vulnerability and resilience and social justice. And finally, some conclusions. So let's do quickly the introduction. These are events, pandemics, and earthquakes. that have several things in common. Both events that are not if, but when. We are always talking about, that there will be an earthquake, for example, in Southern California, the so-called big one. We know that it will happen, but we don't know when. So it's not a matter of if, but it's a matter of when. Also, with in the last webinar 2 weeks ago, we showed that there were many people already in the international community, public health, saying that a pandemic is not it was not a matter of if, but a matter of when. Both have low frequency of occurrence. Both have a high risk for loss of life and economic losses. And both have effects showing social and economic inequities or disparities. And finally, of course, this is a challenge for society resilience. A quick recap of the previous webinar. We discussed scenario events for both pandemics and earthquakes. Scenarios were able to identify many of the challenges that we have encountered in COVID-19 during this pandemic. Historic pandemics and pandemic scenarios illustrate that we are experiencing is not unexpected. I think that most of the issues that we are dealing with have been already pointed out in past scenarios and also by historic pandemics. Scenarios have provided suggested approaches to improve preparedness and overcome challenges in planning. This is one of the very important lessons developing scenarios. Scenarios, of course, are just the beginning. To begin developing more resilient communities, we need to plan now. It's never late. The sooner, the better. So with this, I will leave Kristen to continue the presentation.
Thank you, Jorge. To start, well, Jorge. Oh, there we go. It looks like it caught up with me. Technology sometimes is something of a bit of a challenge at times. Let me back up here. All right, here we go. Every culture has traditionally told stories for things that they could not explain. If we look at earthquakes in Japan, the Namazu, or the giant catfish, was said to cause earthquakes historically. If we consider in pandemics, if you look back in history, right, a lot of that was religious. They believed God was, causing a lot of the pandemics, and it was, because of some behavior, people were not praying enough, and they would look at it and they would look in that perspective to understand what was happening. But as our awareness of scientific understanding has grown, the general public still does not have the same awareness as the scientists. So how we understand risk and how we communicate it is really important. So when we look at public perception of risk, I mentioned in the last presentation that there's a number of people I've spoken with in the general public who really had no idea that this was even a possibility. And they maybe aren't aware of historical pandemics like the 1918 Spanish flu, or they justify that it happened a long time ago. Today we have better public health measures. It's not going to be a problem now, or the risk is really low because it, who knows when it'll happen. It'll happen in this vague kind of someday. So it's not really a high risk to me here right now. So they downplay, they use that low frequency to kind of treat it really like it is a no risk for them right now, and they focus on that part of it. We see that with also perception of risk with regards to earthquakes and the potential for earthquake shaking in our community here in San Diego. Historically, Rose Canyon has been was considered potentially active for a long time, but without specific evidence to demonstrate the activity, it was not classified as active. And that just really means there's a lot of uncertainty. We don't know for certain. We're calling it potentially active. But in 1989, there was concrete evidence found that yes, Rose Canyon is an active fault. It has moved in recent Holocene time. So the state of California has designated it as an active fault. But when we look through how the phrasing in our community and what kind of language is being used to describe Rose Canyon, a lot of times if you Google it, you'll see like the dormant Rose Canyon fault or long considered dormant. And that is kind of counter to what we're trying to communicate to people. That implies that there really isn't much of a risk when we know that Rose Canyon will rupture again. It's only a matter of time. So this is something we need to try to do a little bit better at communicating to people. In fact, if you look at what type of news stories they were saying after Rose Canyon is determined active, their focus is property values will be hurt in La Jolla, right? That's what we're communicating to people, and not that there's a real seismic risk we have to be worrying about. If we look at the Shakeout website, they have a really nice discussion, I think, that makes that explains part of the reason why we struggle with this perception in our community. Our relatively short history in the region has created a false sense of immunity from earthquakes in the San Diego area, but a major earthquake along Rose Canyon could have devastating consequences. I think this is absolutely true, particularly when we think about the idea of if a major earthquake occurs during fire season, then you have two simultaneous things happening. And actually the risk to fire at that point in time, the damages could far exceed any damage caused by earthquake shaking as well. So there is a real risk that we need to do a little bit better at explaining to people and get the public to buy into what we're trying to tell them. And I think part of it comes with this idea of geologic history and how the earth feels about time versus how we perceive it, right? People consider recent time as the past 50 years, past 100 years, but you know, we consider a fault to be active if it's ruptured in the last 11,000 years, and that's a very different scale of time. So Dr. Peter Sandman is a risk communicator, and that's his specialty. One of the things that he's done is he uses this framework of risk really as a function of hazard, whatever the hazard is, and outrage, which is people's perception, fear, anger, and however upset they get about a particular hazard. And he has a really great website with a lot of recommendations, data, publications over the past decades that he's been working in this field. He's been a consultant to the CDC, to the World Health Organization, and a number of other organizations to help them better communicate risk to the public. And he began getting into infectious disease risk in about 2003. And he has three key areas of communication. And one of them is precaution advocacy. If we talk in the framework of public health, precaution advocacy would be warning people about an infectious disease risk that they're overreacting to. Crisis communication, on the other hand, is maybe calming them down about something that they're very upset about but has a relatively low risk. So I would see this as something like vaccines, where we know the scientific evidence suggests that benefits of vaccines far outweigh any small risks that would be associated with them, but the public gets very upset, and there's a lot of outrage. If you look at social media and if you look at the news, there's a lot of discussion. People get very upset and very fearful about this. Crisis communication, on the other hand, would be more like what we're experiencing now. That's guiding people through a public health emergency, pandemic, or an epidemic. And so there is a very high hazard, and there's a lot of fear in the public. For us, when we talk about earthquake preparedness, we would be kind of falling under that precaution advocacy, is that this is a high hazard, but there is not a lot of fear or outrage. So if we want to get people to engage in preparedness with us, we need to actually increase their outrage. So in the last presentation, somebody asked, what does masks have to do with earthquakes? And the way I see it, a lot, but more in the context of risk communication. If we look at what the government and the officials and the World Health Organization, the CDC, the US government's been talking about, and back in March and how they communicated to us, the intent was, well, there's no specific evidence to suggest that wearing masks by the population has any benefit. But the other piece of that was that they're talking about there's a concern for a global shortage in PPE. And right now, the people most at risk are frontline healthcare workers. So this is a legitimate concern. The shortages of personal protective equipment for healthcare workers is absolutely something we need to be worrying about. And they didn't want to cause panic in the general population, have them buy up all the PPE. So they kind of downplayed the risk, and they kind of went overboard the other direction, saying, no, 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 you don't have to worry about this. And they downplayed that to the point where, you know, when they change their messaging later, there shouldn't be much of a surprise that there's a little bit of resistance to that change in message. And I think that when you look back, and previous outbreaks and other epidemics and pandemics have demonstrated the potential benefits of wearing masks. You know, we saw in SARS in 2003 that masks are beneficial. When we look back at the 1918 Spanish flu, masks were used at that point as well as a non-pharmaceutical method to help minimize the spread of a disease. So there is knowledge that this would be a potential benefit, but the way we communicated that information did not send the right message. A consistent message, if we look at what someone else in public health communication says, is that this can be misinterpreted as make a very bold statement one way or the other. Regarding masks, either wear them or don't. But sometimes you need to express the uncertainty you have. Maybe we don't have all the data yet, and it's okay to communicate that to people, because it actually builds trust in your audience. When they know that you might be changing your message as more information is presented, and as you get more data, you know, this may change once we know more, then people actually have more trust in what you're trying to tell them. Taiwan took a different approach, and we look back at how they expressed that information. Their message was save the masks for healthcare providers, right? And what that's really telling everyone is masks are important, and right now we need them to help keep our healthcare workers safe. So that's very useful. If we look at the CDC, what they're saying in July, they now have come and basically done a complete 180 and saying now all the latest data and science affirms cloth face coverings are a critical tool, and especially when used universally. And this was based off of 2 case studies that they relied on for this. The first was in the Journal of the American Medical Association, a hospital system in Massachusetts, which has about 12 hospitals and about 75,000 employees. They implemented a universal masking policy where not only the healthcare providers wear masks, but also the patients. And as they unfolded this so that both groups were wearing masks, they found that although initially there was universal masking, or initially there was they were starting to see the significant increase in their own healthcare workers contracting COVID. Once they began to implement this new policy, the caseload actually decreased significantly, and it was very helpful. The second case study was with the apparent absence of transmission with COVID, and I'm sure a lot of people read about this. It was in the news with 2 hairstylists who had COVID. They were COVID positive in Missouri, and the salon that they worked at actually had a policy of universal masking, and there was about, in the time that they were symptomatic and working in the salon, there was about 139 clients that both of them came into contact with. So through contact tracing, they went back, they looked at all the clients and all their secondary contacts. None of them became ill, and none of the clients who were volunteered to be tested, which is about 50% of the people, actually tested positive. And these 2 were in 2 of many cases that also showed that. So this idea that we need to develop messages that will influence positively the public's response and behavior during a medical emergency or any other natural disaster is really important. We want to make sure that they are going to take the right steps to respond appropriately. And if we look back at what other countries had experience with, the National Academy's publication about exploring lessons learned from a century of outbreaks pointed out that Liberia went through this with Ebola in 2014. They did not have a good national protocol regarding risk communication, and they initially had a lot of mistakes in their public messaging, and they had to change that to change the message, to change the effect and how the public responded. So people were originally told they would die if they contracted Ebola, and patients were very scared of that, and they did not go seek treatment, and that spread the disease. When that changed and they were encouraged to seek treatment to increase their chances of survival, understandably, a lot of people actually did go seek treatment. So that was a beneficial change. So what does this have to do with earthquakes? Well, we have a lot of opportunity for communication of risk and for just communication in general. for preparedness efforts to explain to the community what we want them to be doing and what we think would be best practices to increase resilience, but also in crisis communication mode after an earthquake hits. How are we going to be able to reach out to our people and give them the best guidance, explain their risk of aftershocks, who to contact for help, where to go for help if they need it. So there's a lot of opportunities there to learn from on a national scale how people respond. The other piece is that communicating technical information in COVID has been interesting to see how the public responds. I mean, this is, in general, a non-scientific population can struggle with some of the concepts that we are trying to explain. When we talk about exponential growth, that has been something that has been a struggle. People think very linearly. So when you're seeing small numbers at the beginning, they don't perceive the scale of the problem coming their way. And you can tell them exponential growth and they nod their heads and they think about, well, it took this many days to get to here. It'll take that many days to get to the next group or double that. But what they don't realize, if we take, for example, the Event 201 scenario that was developed by the Johns Hopkins Center for Public Health and the Bill and Melinda Gates Foundation, in that event, every week was the doubling period. So the first week 1, you have 1, and week 2, you have 2, and week 3, you have 4, and so on and so forth. It might take 10 weeks to pass 500 cases, but then the very next week, you're going to double again and be at 1,000. And that's where things start to explode. And that concept was tricky. And we see that even here with earthquake engineering. During the National Earthquake Conference, there were several speakers who did talk about challenges with technical communication. Both Lucy Jones and Julian Balmer gave excellent talks about this and the challenges with communicating to the public. One of the things that Lucy Jones had presented was a discussion of magnitude and the concept of magnitude and the energy release. We see this here, right? People look at these numbers and they think very linearly about the difference between the Northridge, which is a magnitude 6.7, and the scenario shakeout for the Southern San Andreas, which is, what the scenario event we've been discussing for Southern California. These are vastly different amounts of energy that are released, and they have huge, they're just, when we talk about a log scale, it's very significant, the difference between these two. But people think, well, 7 is greater than 6 by only 1. And they think linearly about the problem. And so it's harder for us to communicate. I think visually, it's a little bit easier, when we start to project on top of maybe the Northridge and we start to look, oh, this is what the fault would look like. And that's the difference between these two events, right? The Northridge fault rupture area is very small in this same scale when you look at the difference between what the shakeout scenario would entail for Southern San Andreas. It has it sinks in a little bit better to the public. Another person had noted as well that who was involved with the Shake Alert project at the USGS, they observed some trending confusion after Ridgecrest. A lot of people did not understand the differences between intensity and magnitude. And when they look at an image like this and they see intensity and they see numbers next to it and they think, is that the magnitude? There was a lot of confusion about this. In fact, in general, with our magnitude communication, you still see in the media people talking about Richter magnitudes, and we really don't use that same scale anymore, but there have been changes over the years and it doesn't always get passed on to the public. Now, one of the things Lucy Jones was mentioning is let's talk in numbers that make more sense to people, right? This idea of a different scale to quantify energy released in a way that is more realistic and that people will actually understand. And I think that's a very interesting point of view to communicate these numbers and what they actually mean. So there are some strategies based on looking at what has happened with COVID, how they have relayed crisis communication, and what we can do to better communicate in general for either during, after earthquakes or in trying to prepare for earthquakes. So with crisis communication, I think that there's a couple opportunities to look from some of the documents and discussions that people have had about effective communication for something like COVID. And one of the things would be, don't over reassure people. Right? If you try too hard to keep people calm, and it can actually backfire. People are either more fearful because they don't trust the message, it's out of line with what they know to be true, Or they end up thinking, great, I have nothing to worry about. I can go out and I don't have to wear masks and I don't need to social distance because there's not really a problem. The government's got it all under control. So it can actually go the wrong direction. And one of the other messages that they didn't really clearly communicate was this idea that once we came out of lockdown, the idea that everything would be back to normal. That was not very clearly explained to people, that we're still going to be living with this pandemic for the next year potentially. And once we come out of lockdowns, we still need to be alert and we need to be vigilant about making sure that we are taking appropriate safety measures to do this safely. And there wasn't a lot of good communication about what to do when we did come back out of this. The other thing is to proclaim uncertainty, let people know as things are changing so that when your messages change, it's not inconsistent. Validate people's emotions, let them know that it's acceptable to be scared as long as it's proportional to the risk that there is. Give people things to do. We saw people, for example, taking it upon themselves, right, to buy out all the toilet paper in the stores, all the bottled water, all the food in the grocery shelves, because panic is settling in when the messages are out of line with what people are thinking is appropriate. So if you give people lots of things to do, or a menu of choices of things to do to prepare or to do to handle it, they feel like they have a little bit more control. Apologize and admit to errors, not something that the government likes to do or that other public officials like to do, but it is a recommended strategy to get people to be more trusting in the messaging and share the dilemmas. For preparedness efforts, there's a slightly different approach. What we want to be doing is keeping our messaging simple and short, because a lot of times our audience may not have much interest in what we're trying to tell them. We need to make it interesting and we need to plan for the long haul. It is okay to let people be a little bit scared, to appeal to their emotions, because fear can be a useful tool in getting people to do something, but it needs to be, again, proportional to the risk. You don't want people out there, coming up with bunkers and hunkering down thinking that the next earthquake will happen any second, but you do want them taking measures to make sure that they have a family plan, that they might have food and water for a reasonable number of days, and they might have flashlights or other ways to stay home and be safe, in the event of an emergency like that. Dr. Sandman, again, with his precaution advocacy messaging, had talked about this model that he recommends, which is first you identify what your goals are. What do you want ultimately to happen? Once you do that, you can identify who do I need to target for my audience to achieve these goals. And then you make sure you characterize them really well. You know their attitudes, values, their emotions, how they use media. And once you understand them really well, then you can find out what appeals to them so that they will be amenable to hearing my message. Then you figure out what ways you're going to communicate to them. Are you going to use social media? Are you going to do interviews with the conventional news media? Are you going to go on radio shows? How are you going to outreach to them? Are you going to send stuff in the mail? And then who is going to be the person who communicates this information? Do I have some sort of a trusted scientific figure I'm going to be using to communicate this to people? Then once you have that framework set up and you understand all of those pieces of the puzzle, then you can actually develop your message so that you can actually hit your targets appropriately. And they recommend testing out the messages. If you can't do it on a widespread, in a scientific, more rigorous way with a, testing a group of people, then test it within your own family or friends and see how do they respond to that message. Another kind of big topic we've seen with COVID is the spread of misinformation. This social media kind of as a double-edged sword, spreading conspiracy theories, like that virus was created as a biological weapon in China, or misleading claims for health remedies like coconut oil will kill the virus. This misinformation can be very harmful because it can cause people to be trying potentially harmful or ineffective home remedies, which can be dangerous. They can overreact, which can trigger panic buying, or underreact on the counterpoint of it, which is, I don't think I have anything to worry about. I don't need to wear masks and I can go hang out in a big group of people with nothing to worry about. So these are all concerns because each of these problems, can harm people and spread the disease and isn't helping us. There's a Forbes contributor named Alison Escalante. She had a very interesting statement in one of her articles that she said, That's the power of social media. It can introduce people to practices that sound like Saturday Night Live skits, and people actually do it. And to me, that's exactly, she's right on the money. And it's a little bit scary to think about the things that people will trust in social media, whether it's accurate or not. And this term that's used for this spread of misinformation is an infodemic. There's been studies, a number of studies in recent years talking about this, and Harvard recently looked at, in particular, communication with COVID-19 for disinformation. And they looked really at the differences between traditional news sources and social media, and what kind of communication is being transmitted between the two. And what we're finding more and more these days is that social media is increasingly being relied on as a primary source of news, which is concerning given the misinformation on these platforms has been heavily documented. So traditional news, if you look at the study that they performed, spends more time on true and accurate information, accurate public health recommendations, and they spend a lot of time combating misinformation. But the opposite is true of social media. They basically spend, there's almost nobody combating misinformation, and a lot of misinformation and lack of accurate technical information is being communicated, unfortunately. And so this is something that is going to be a real struggle for us. If we look at other perspectives, some psychological researchers have been trying to consider, why is it that people are more likely to share things that are either true or false? What is going on that this is happening so much with social media? Why do they believe it or spread it? And so what they looked at is a study of people, I think it was about just under 2,000 people in total that the study considered, is they wanted to know, if they sent a variety of both true and false stories, are you willing to share this information? And if they just asked if people were willing to share that information, the difference of whether or not it was true made no difference to people's choice to share or not. But when they initially prompted people first to, do you think this is an accurate article? And then they prompted them, would you share this? They saw a sizable difference in the way people responded to making choices about what they would share if they were considering accuracy in that decision making. And so that's an interesting thought about how we can be using social media in a way to try to actually help increase more accurate content. One of the biggest problems with the spread of misinformation is that if you repeat a lie often enough, people will believe it, and you will even come to believe it yourself. This has been something that has been known and observed for a long time. And with social media these days, the way it can spread almost, virally, essentially, through the internet and to transmit quickly and through large groups of people is part of the reason that this is such a concern. We've seen this with other earthquakes, for example. If you look at, Ridgecrest afterwards, the risk of what to do in an earthquake, what's the safest thing to do? People are talking about stand in a doorway or go in a bathtub or run outside, or you've heard of the triangle of life hoax. These things are circulating in social media, and yet our drop, cover, hold on, which we've been working really hard to communicate to people, is not part of the conversation, and we need to be changing that. And even after the South Napa earthquake in 2014, internet trolls were using the earthquake as an opportunity to spread malicious content. It took a lot of effort on the part of officials to try to remove that and prevent it from being circulated in the mainstream. There have been documents, though, in recent years. The Department of Homeland Security released a document to help guide best practices for combating misinformation in social media. And this provides some really good recommendations and some best practices for challenging this misinformation, some of which may also apply to preparedness efforts, in my view. How can we use non-emergency social media interaction with the public to try to get more accurate information out there? So part of it is preparing simple, clear visuals and graphics to circulate, tweet or post to correct false information, and acknowledge rumors when appropriate and state facts, redirect readers really to accurate sources of information. But they have some great recommendations, and I recommend that anyone who's interested take a look at this document. Investment is also something that has been pointed out, the challenges with getting people to buy into preparedness. Preparedness requires that investment of time, of money, of resources. And it can be difficult when we have competing needs and limited resources. And really, there's a lot of, returning annual threats that we have to deal with that obviously, and, I understand why it can be a challenge to focus on something that has a much lower frequency of occurrence, but is also high risk. But we still need to find some space to allow for investment in this area. We look at pandemic scenarios that were developed in the last 2 decades, and they demonstrated the need to invest in PPE and have a surplus. They talked about having better plans for national preparedness because it was only a matter of time. They talked about the need for communication and highlighted the risk of the spread of misinformation. And so when we have these tools and we know what we need to do to take steps forward to be better prepared, we should do what we can to actually try to invest in preparedness. I think during the National Earthquake Conference, the Chief of Police for Ridgecrest, Jed McLaughlin, had a really nice presentation, and I think that his communication was very heartfelt because as somebody who is responsible for his community, being the police, and he's responsible for safety, and also as a member of the community that was hit by the earthquake, he was very heartfelt in his responses to getting people to be prepared. And his point was that we need to remind people to be prepared. And one of his messages has been, if you prepared for the earthquake, that's great. Now it's time to prepare again. If you were caught off guard, now is the time to prepare yourself for an earthquake or another disaster. When people talk about investment, a lot of it is hard to find the reason to spend that money, but a lot of studies have shown that money invested in disaster risk reduction can actually save money in emergency response and rehabilitation down the road. So this is money well spent. We think about how much money has been spent with, shutting down our economy. And would we be in a better position right now if we had spent a fraction of that money on having appropriate PPE, having a better system in place to be able to manage and handle this and communicate appropriately to people? Would we be in better shape now? Would our economy be better? One of the things that was highlighted in the San Diego earthquake scenario was that if you spend $1 on seismic mitigation, then you might save between $2 and $4. So you get a return on investment for that money saved. One of the other things that was observed after Ebola, if we start looking at some of these National Academies publications, is that recent epidemics and pandemics have highlighted the need for increased preparedness, and especially at a national level. But they noted that one of the struggles was going to be sustaining necessary funding, political attention, and leadership over the long period of time. And that is always going to be a challenge and something we're going to have to be thinking about. How do we, if we know that this earthquake may not hit for the next 10, 20, 30 years or whatever it's going to be, how do we sustain that investment and that preparedness effort through that time? So there's things we need to do, identify incentives for preparedness. I think that's one of the things that was observed in some of the pandemic scenarios, is trying to incentivize people to want to be more prepared and engage with the global leaders and public health officials. I think that can be a very useful tool. Communication with decision makers and the public, develop meaningful coordination and public-private partnerships. And outreach to youth. I think there's lots of opportunities for us to be investing in preparedness in our communities. I'd like to just finish with a comment by Dr. Lucy Jones. She wrote an op-ed in the LA Times last year before the Ridgecrest earthquake about the California earthquake drought. And at that point in time, it had been about 25 years since there was a major earthquake in Southern California. The last earthquake was in 94 in Northridge. And she pointed out that, it's going to happen again at some point. So what happens to our communities then will depend on how well we've prepared. And maybe we have 2 years or 5 or even 10 to prepare, and how will we use that time? So I like the idea of you looking at this time as an opportunity, right? Not allowing us to delay, but using it as an opportunity to be better prepared and become more resilient. And with that, I will pass it back to Jorge. Thank you.
Thank you, Kristen. So now we are going to discuss some aspects of common aspects on social vulnerability between pandemics and earthquakes. Just a few days ago, the National Academy of Medicine had their 50th annual meeting. One of the themes was COVID-19 and climate change, confronting urgent threats to human health and society. The keynote speaker was Dr. Anthony Fauci. This slide come from his presentation in the meeting. He was presenting one of the findings of the impact of COVID-19 in the country. The most pervasive disparities are observed among African American and Latino individuals, and where data exists, American Indian, Alaska Native, and Pacific Islander populations. The next slide, Dr. Fauci showed this graph, very illustrative. So you see in the horizontal axis, the rate per 100,000 population, and then by race, ethnicity, Hispanic, Latino, American Indian, Black, non-Hispanic, Asian Pacific Islander, and finally white. So you see the impact on Hispanos, American Indian, Alaska Natives, Black, non-Hispanic, and Asian, and the impact on the white population. So there is a clear here relation between, in terms of impact related with race and ethnicity. This is the data from the California Department of Public Health. Here on this column, you see the race, ethnicity, Latino, white, Asian, African American, multi-race, American Indian, and so forth. You see here the number of cases and the percent of cases, 61% just Latinos. The number of deaths in this column and the percent of death, Latinos almost 50%, 48%. White population, 30%. So non-white, almost 70% of the population in terms of death caused by COVID-19. We have to also mention that almost about 30% of cases are missing, miss the rate ethnicity information, and death only have 1% missing race ethnicity. So that means that the information about death is more reliable, more accurate, and reflect better the reality. At the level of the county of San Diego, we see this type of map where we see the different regions of San Diego County, and this is the rate per 100,000 also people, and you see here the variation of the rates. The darker the color, the highest the rate, the highest the impact. And just very soon, without matching inspection of this figure, of this map, we see that the color is darker here at the south, the central region and the south region. We have to remember, for those who are not familiar, we are aware that we have participants from Europe, Asia, and all the American continent. This is San Diego County, and the international border is this one. This is the international border with Mexico. So the concentration of Hispanic population here is very, very high. Again, showing by races, ethnicity here, and this is for each of the zones, the impact, and this is in general for the entire San Diego County. Again, Hispanics have the greatest concentration of the impact of COVID-19. We have to take a look at the hazard that we have, right? There are several hazards that can be classified in different ways. This is one way of classifying this. Here, we have those natural hazards that are being exacerbated by climate change at this moment. For those who want to have more information about how can climate change affect natural disaster, you can visit here this USGS website from the United States Geological Survey. Then we have these geohazards, including earthquakes, landslides, tsunamis, volcanic eruptions. We see also, and we can discuss, however, it's not the topic of this presentation, how climate change is affecting the effects of causing by earthquakes. And also we have, of course, here the health hazards, right, related with pandemics, epidemics, etc., and other industrial hazards, including fires, oil spills, and so forth. This is a figure from a report recently published by the United Nations. So this is the total number of deaths by disaster type in the last 10 years, between 2000 and 2019. We see here the number of fatalities caused by earthquakes is substantially higher, 58%. This is globally, okay? 58%, more than 700,000 people killed by earthquakes, by storms, about 200,000, by extreme temperature, more than 165,000, by flood, and this is a combination of drought, landslide, volcanic activity, mass movement, and so forth. Then these are the numbers from COVID-19. As of today, 3 hours ago, almost 4 hours ago, the number of casualties worldwide was more than 1 million deaths, and in the United States, 228,808. This information is taken, of course, from the Johns Hopkins Coronavirus Resource Center. So it's not even 1 year that the world is experiencing this pandemic, and the number of fatalities already is much larger than the number of all fatalities caused by these natural hazards in the last 10 years. And this is another plot chart published by the same report, United Nations, UNDRR. And here they are comparing the fatalities, number of deaths here on the vertical axis, and here the level of income of those people that were killed. And we can see here very clearly the relation between the number of deaths with the level of income. So here we have a group classified as low income, low middle, upper middle, high income. So the higher the income of the people, the lesser the number of fatalities. So we can see here very clearly that the number of deaths is concentrated for those people with low income and low middle income. So natural disasters have a disproportionate effect on the world's billions of urban poor. Poverty causes disasters, and disasters cause poverty. So there is a circle there that we have to break at some point, somehow. One of the disasters that highlighted the importance to consider social vulnerability was the Hurricane Katrina. Most analyses when we are evaluating natural hazards are focused on physical processes and built environment. We are doing, this probabilistic analysis, risk analysis, etc., developing engineering systems that are capable of resisting the natural hazards, like, for example, in this case, levees, dams, seawalls, detention bases, etc. But how about people? We need to ask some additional questions regarding with the impact to people. So these questions include, some of these questions are presented here. For example, which places are most socially vulnerable? Who are the most vulnerable? How equitable is disaster management? How do social and physical dimensions of hazards interact? So these are some questions that are listed here from easy to more difficult, and also the answer will be less relieving and here more relieving as we move in this direction, asking and answering these questions and how we can apply to a particular region or location. There is this conceptual framework of vulnerability that is called the PAR model, pressure and release. We can see here the occurrence of a disaster. So a disaster is occurring because there is a progress of vulnerability in a given community. And this progress of vulnerability starts from root causes that are societal, scale, resource, and power distribution, going to dynamic pressures that channel root causes to specific unsafe conditions, and finally, unsafe conditions that differential exposure at the local scale. So we have some unsafe conditions in the physical environment, local economy, social relations, public actions, and institutions. And here in the local economy, we see that we have already some livelihood at risk, people with low income level. And root causes, we start thinking, looking at power, the limited access to power, structures, resources, and also some political system or economic system that are underneath all these problems regarding with the vulnerability. How to reduce this disaster pressure? How to minimize or try to minimize also this disaster pressure? It will be by reducing the social vulnerability. The CDC, the Centers for Disease Control and Prevention, developed a social vulnerability index as a way to try to identify and measure this social vulnerability. This vulnerability refers to the potential negative effects on communities caused by external stresses on human health. Such stresses include natural or human-caused disasters or disease outbreaks. Reducing social vulnerability can decrease both human suffering and economic loss. And this index, the CDC Social Vulnerability Index, uses 15 US census variables to help local officials identify communities that may need support before, during, or after disasters. Here is a chart showing all these variables, the 15 factors coming from the census, grouped in this way: socioeconomic status, household composition and disability, minority status, language, housing type, and transportation. So here we have below poverty, unemployed, level of income, no high school diploma, household composition and disability, the elderly, the young, older than 5 with a disability, single parent households, especially women. Minority status, minority, here we're including the problem of race and ethnicity and also other considerations, speaks English less than well, and then finally housing type and transportation, multi-unit structures, mobile homes, crowding, people not having vehicles and have to use the public transportation, exposure is greater, and group quarters. So this social vulnerability index developed by the CDC can be used to allocate emergency preparedness funding, estimate the type of amount of needed supplies, such as food, water, medicine, and bedding, decide how many emergency personnel are required to assist people, identify areas for emergency shelters, create evacuation plans, taking into account the physical limitation of the peoples, special needs, etc. Identify communities that will need continued support to recover following an emergency or natural disaster. These days, this CDC Social Vulnerability Index has been extended to develop this COVID-19 Community Vulnerability Index. In this case, the Sorgo Foundation has used the same variables that is used by the CDC included in the Social Vulnerability Index, and they added other factors related with epidemics and also healthcare system factors. So combining all these factors, they developed this CCVI, or the COVID-19 Community Vulnerability Index. So here you have a description of these factors again, and combining all of these factors, they have developed this map, the COVID-19 Vulnerability Index. So you can see here the scale of the colors. The lighter the color, very low vulnerability. The darker the color, very high vulnerability. You can see here, especially this area, this region, looks very dark. If we take a look here at California, the state of California, and we take a look here at the San Diego County, we see a big difference between San Diego County and Imperial County. Actually, this county has one of the largest Hispanic populations in the state. There is also other indices. This is from the County of San Diego, the Healthy Places Index. Each community area receives an HPI score. The HPI score is based on 8 healthy community conditions: economic, education, transportation, social, neighborhood, housing, clean environment, healthcare. So these are considered social determinants of health. So based on these indexes, they developed this map showing the distribution, identifying the different regions with these indexes. And we can see here that most healthy communities are these ones, and the least healthy communities are these ones. You can see here a very clear example, the physical difference between these communities that receive higher healthy places index. So probably this could be also called like wealthy places index. There is a strong relation there within health and wealth. Also, the United Nations has another index, the Human Development Index. This index provides a composite measure of 3 dimensions of human development: living a long and healthy life, having an education, having a decent standard of living, a higher HDI, a higher Human Development Index implies higher levels of human development. How these were applied or are being applied to earthquakes, we have here an example, the Global Earthquake Model, GEM, social vulnerability indexes, whether quantitatively or qualitatively derived, are intended to assess the potential for aggravating physical losses due to pre-event inherent characteristics in society. The index development process at all geographic scales draws from current indices and methods that include, but are not limited. They are including this social vulnerability index that we already discussed, the disaster risk index of the UNDP just presented, and also the urban seismic risk index. Combining these indexes, they include the consideration of social vulnerability in the estimation of losses under this global earthquake model. This is just a kind of summary of the different social vulnerability database that we have identified in the literature. Then comes some issues, how we are going to relate these social aspects, social vulnerability with resilience, earthquake resilience, and in general with community resilience. So health equity is our final goal by targeting programs to reach down and give people a box where they can stand in order to reach health equity. These cardiometabolic and cardiovascular disparities by race, ethnicity, geography, socioeconomic status exist. They are sizable. They are likely multifactorial, but rarely due to genetics. They are persistent, and I think all of us will agree unacceptable. At this point, we are realizing that this is not about race. Belonging to a specific race doesn't make more vulnerable to a specific disease. It's those socioeconomic conditions behind races and behind ethnicities. So actually, as some people are talking now, social scientists, it's not about race, it's about racism. And some social scientists are talking about systemic racism, and others are talking about structural racism. We are not social scientists, so we don't understand well this terminology, but this is something that we are learning now, evaluating how the pandemic is evolving and how we can compare and how we can learn from this pandemic for earthquake preparedness. So we are talking about equality or equity. So this cartoon, I think, shows somehow the difference between equality and equity. Not is a matter that everybody receives the same, because not everybody needs the same. So equity is more related with prioritizing resources protection based on need. So let's give people what they need. And maybe some will need more than others, and that will be a fair, create a kind of fair situation. But then, if we think a little deeper, we realize that, for example, in this particular case or example here, it's not a matter just only of equality or equity. It's a matter of why that thing should be there. So maybe if we start thinking about these terms, is that we are going to discover that it's not a matter of equality or equity, it's a matter of justice and social justice if we are dealing with these social aspects. Some people have barriers to access to good education, to good employment, to good housing, to good healthcare. So if we bring down these barriers, I think that we are going to develop social justice. Of all of the forms of inequality, injustice in healthcare is the most inhumane. This is what Martin Luther King said in 1966. There are some impact to the entire society because of these racial inequities or racism or injustice. So our inability to protect ourselves and each other is directly tied to our inability to reckon with injustice. So the lesson, inequities in these populations don't just mean higher transmission in these communities. They fuel the spread of COVID-19 across entire regions, even in the presence of restrictive public health precautions that people follow. Because of racial inequities, people of every age, socioeconomic status, and race are contracting the virus and dying far more often than they had to do. This is an article that was just published recently, a few days ago, and the authors are professors and scholars from Yale University, Carnegie Mellon University, and UC Berkeley. From the same authors, we realize that also inequality can put everybody at risk. The demography and geography look different, but there is a common theme. The inequality undergirding our stratified society is putting us all at risk. COVID-19 threatens these groups more than others, and yet all face a greater threat because of their vulnerability. So how do you know if you are at risk during a disaster? And we know that we have international participants here. What is it that determines the likelihood that you will lose your life or your limbs or your livelihood or your home? The answer is somehow simple. To be at the greatest risk, you must be poor and live in a country with corrupt, dishonest, or ineffective or inept governments or inept leaders. Conclusions, probably we have the path forward. We have to improve the risk communications and overcome and address all these issues pointed out by Kristen. We have and we need to address and reduce social vulnerability. If we want to reduce actually earthquake risk, if we want to create earthquake resilience societies, if we want to reduce as much as possible all the impact of hazards, we have to incorporate social justice. So equity, diversity, inclusions address not only race and racism, but also problems associated with other minorities. So only probably in that way is that we are going to develop societal resilience. Thank you for your attention.
Thanks, Jorge and Kristen. We're going to proceed with the questions. Please enter your question in the questions window. We already have a couple of questions, so I'm going to start with these. Question from Jeff Rubin. It seems that when, not if, or it seems that, quote, when, not if, quotes, is not a useful message. The issue is imminence versus inevitability, which is a different message. Any comments from the speakers?
Yes, I agree with that. Actually, we are discussing with some people about this also, what I used to say is that the occurrence of an earthquake, the probability of an earthquake occurring, for example, in San Diego is 100%, but we don't know when, and we have to be prepared anyways.
Okay, thank you. Next question. Pandemics like COVID can create discrimination from one group of individuals against another group. How can experts alleviate this discrimination, especially in the beginning of the pandemic when knowledge about the pandemic is low?
Again, as I said, I'm not a social scientist, so I think that these issues or this question is maybe more appropriate for someone who has experience how to deal with these issues. But there have been several aspects related to racism, also in how this spread of about even the characterization of the pandemic, of the virus was done. But actually don't have much to contribute. Kristen?
Yeah, my point would be, I mean, I agree with you. And I think my perspective, just based on what I've read, would say that the communication from our leaders and from all of the government officials needs to be really clear. And, you know, that this is not, because I agree with you that, you know, like early on, there was language being referred to as, you know, since the virus originated in China, and they could have come from anywhere, really. These viruses spread, it can be from anywhere. But, and there is racism that was seen because of that. And I agree that anytime there's events where people are fearful, I think there's more of this comes down to like how people respond to conditions that where they become scared and how they kind of act in groups and kind of mobs. But I think that communication needs to be the key piece in how we message to people and how we try to minimize anything that we're hearing that is like that, and how we try to combat that misinformation that's being spread.
Okay, let's go to the next question from Victor Wang, who already left the meeting, but I'm going to read his question anyway. He is with the University of North Carolina at Chapel Hill. He says, first of all, huge thanks to the panelists. Great presentation. Should there be any differences between the efforts to improve preparedness for different hazard types? For example, large earthquakes versus pandemics. And how about some hazard events of other hazard types with even smaller frequencies and larger potential impacts, such as the 2004 Indian Ocean tsunami, the 1908 Tunguska impact event, or the 1859 Carrington geomagnetic storm event? How can we communicate, or sorry, how can communities be ready for those types of events? Is it even possible for communities to truly get ready?
That's a good question. I think that our efforts to some extent do need to be proportional to the risk and the likelihood. You know, we've seen this year in California, for example, fires have been, it's been very dramatic, and the state has been very hard hit by numerous severe fires. And so fire risk is real. We need to be recognizing that our efforts for preparedness and all kinds of things need to be appropriate to what we anticipate and expect. And we need to be educating our communities about how to handle this, because the more I think the individuals are able to some extent, be prepared on an individual basis, we can do better as a community. And I think some things are just going to be more challenging. One of the interesting things I was reading as I was going through a number of these documents is that, you know, you can prepare for things like a meteor strike, but, you know, is that really where we need to be spending our money, right? Some things are going to be much lower risk. Like at some point, the Earth will probably be hit by one, but is it something we need to be worried about soon? So I think taking into account to some extent the likelihood, but our conversation here is more about, you know, earthquakes will happen, and they will happen at a higher frequency than maybe some other things. But it's a great question, and I think an interesting answer to see how we deal with those issues as we go forward.
Yeah, and also I would like to point out here something that because the question is about phenomenon of hazards, disasters that can occur in many places around the world. And it's important about international collaboration and international preparedness. So to work together to coordinate efforts, etc. I think that this is very, very important, especially that, for example, a pandemic is a hazard is affecting the entire global population. It's not affecting just only one country. It's affecting the entire global population. So we have to collaborate all countries internationally to be prepared and to fight a hazard. No country will be safe if all the countries are safe. So that's true. And also, if we are talking about pandemic. So we are talking about hazard related with climate change, global warming, etc. This has to be done and tackled with international community cooperating, preparing for that. So finally, I think that we are here facing, something in which we have to be careful about our planet, about the humankind. No country should be first, the planet should be first. And all the countries, all populations should be work and think about that. We have to preserve our planet. We have to preserve and save the humankind and provide the best condition that we have. If we don't do, for example, if we don't collaborate internationally, we cannot fight global warming. If we don't do this, there will be some natural hazard that will be exacerbated. And we are going to have again this cycle of disasters, etc., etc.
Okay, thank you. A question from Raul Sharma. It takes technical background to understand in-depth research on a given pandemic, which is why most lay people revert to information on social media. How can individuals understand more technical data information on a subject they do not have proper education on?
Yes, Kristen, go ahead.
I think that if somebody doesn't have a lot of technical background, there is only so far we can go. But as people who are trying to communicate technical information to a general population, we have to find ways to some extent simplify our messaging so that it can be understood at its most basic sense, so that at least people can follow guidelines as we would like them to do. And discerning whether or not something is true or false on social media may be more challenging for some people. But if on the whole we have better efforts in place to try to slow that spread and try to reduce the amount of misinformation that is being spread, then what is being presented to everyone will be overall hopefully more truthful. So I think that's really a big effort we need to do. Is those who are able to try to identify misinformation, we have to try to do more to slow that spread and to try to reduce false information that's being circulated. Yeah, I agree, it's a big challenge to try to communicate that to people who may not be able on their own to discern what is true and what is false, and understand some of the technical pieces. Jorge, I don't know if you had anything else to add.
It's about also how we communicate technical things to lay people, right? I think this is very difficult, but also it's about that. I think that probably one of the causes that people follow all this misinformation is because probably we need more reinforcement of education, the K-12 level, related with science, engineering, etc. So we need to develop more trust on science, on people. And if you didn't see the value of science from the very beginning in early education, they will not trust science later on in their lives. And this is something that I think that we are observing here, why people tend to follow all this misinformation and not follow what the scientists, the experts are saying. So probably more need on reinforcing the teaching of science in K-12 school.
Last question. How will the focus be restored to earthquakes when the deaths from earthquakes over 20 years in the US, I'm assuming, are less than COVID-19 in several months?
I don't think that the goal is to take away the focus of a pandemic with the conversation. Obviously, preparing for pandemics is an important thing that we need to be doing and moving forward. Once we come out of this, eventually, this is going to be a much bigger awareness for the world. For what to be concerned about and how to identify and slow the spread of diseases as novel outbreaks occur. But I think one of the points we made is that when we know we have a risk and we know that there is going to be damages, and we want to be more resilient in our community, we want to do what we can to try to encourage that. And I think to some extent, some of these natural disasters anyway, some of these conversations can overlap, right? With earthquakes and the potential for fire hazard, you can have that conversation. I think that, disaster preparedness, there might be some intersects with the how individuals and how the public can prepare together, and how you get community involvement even at a smaller scale, with people's church organizations. It doesn't have to be just earthquakes, it can be, multiple hazard preparedness. So I do think I agree with you that this pandemic is, far and away more severe globally than one individual earthquake will be, but we still want to do what we can to prepare and to encourage people to be aware of the risks that we do have with the natural world. Jorge?
Not much to add. I think that I agree with you.
Okay, thank you very much to the speakers. And thank you very much for attending this webinar. The next part, the last part, the third part is going to be in 2 weeks, November 13th. Next steps for earthquake preparedness in the San Diego community. And we'll have Jorge Ryan DeHart with the County OES in San Diego, and David Harrison with the city of Carlsbad. If you haven't yet registered, you still have time. And remember that it's for free. A couple of more announcements. There's going to be a survey you're going to get in your email pretty soon after this meeting is over. So please fill that in when you have a chance. And we're also listing here our websites. And if you're interested in joining EERI, please go to eeri.org/join. Thank you very much for attending, and have a good weekend.
Thank you, everybody.